Hi everyone, welcome to Knowledge Zone, the channel where you can learn something new and interesting every day. Today we're going to talk about OCD, a disorder that makes you do things you don't want to do. OCD stands for Obsessive Compulsive Disorder, and it affects about 2.3% of the population worldwide. That means that 1 in every 40 people has OCD, and maybe you or someone you know is one of them. But what is OCD exactly, and how does it affect your life? In this video, we will explain what OCD is, what causes it, how it is diagnosed, and how it can be treated. And don't forget to like, subscribe and comment if you enjoy our content. OCD is a mental disorder that causes you to have unwanted and intrusive thoughts, images, or impulses, called obsessions, that make you feel anxious or distressed. To cope with these obsessions, you feel compelled to perform certain actions or rituals, called compulsions, that temporarily relieve your anxiety. For example, you might have an obsession about germs or contamination, and feel the need to wash your hands repeatedly until they are clean. Or you might have an obsession about harming yourself or others and feel the need to check the stove or the locks multiple times to make sure they are off or secure. These are just some of the common types of obsessions and compulsions that people with OCD experience, but there are many more. In fact, OCD can affect almost any aspect of your life, such as your religion, sexuality, morality, or appearance. And while some people might think that OCD is just a quirky personality trait or a harmless habit, it is actually a serious and debilitating condition that can cause significant distress and impairment. There are many different themes and manifestations of OCD, but some of the most common. Contamination. This is when you have an obsession about being dirty, infected, or exposed to germs, chemicals, or diseases. You might feel the need to wash your hands, shower, or clean excessively, or avoid touching certain objects or people. This can cause you to spend a lot of time and resources on cleaning and damage your skin or health. Harm. This is when you have an obsession about causing harm to yourself or others, either intentionally or accidentally. You might feel the need to check things repeatedly, such as the stove, the locks, or the car brakes. This can cause you to waste a lot of time and energy on checking and limit your freedom or mobility. Symmetry. This is when you have an obsession about order, balance, or perfection. You might feel the need to arrange things in a certain way, such as by color, size, or shape. Or repeat actions until they feel just right, such as tapping, counting, or saying a word or phrase. This can cause you to spend a lot of time and effort on arranging or repeating things, and disrupt your normal routine or productivity. Religion. This is when you have an obsession about morality, sin, or blasphemy. You might feel the need to pray excessively, follow strict rules or rituals, or confess your thoughts or actions. This can cause you to experience a lot of guilt and shame, and interfere with your spiritual or religious beliefs. Sexuality. This is when you have an obsession about your sexual orientation, identity, or preferences. You might feel the need to question your sexuality constantly, seek reassurance from others, or avoid certain people or situations. This can cause you to experience a lot of doubt and confusion, and affect your self-esteem or relationships. These are just some examples of the types of obsessions and compulsions that people with OCD experience. The important thing to remember is that OCD is not about the content of your thoughts or actions, but rather about the way they make you feel and behave. The exact cause of OCD is not fully understood, but there are some factors that may increase your risk of developing it. One of them is genetics. If you have a family member with OCD, you are more likely to have it too. Another factor is brain structure. Some studies have shown that people with OCD have differences in certain brain regions and chemicals that are involved in regulating emotions, impulses, and habits. A third factor is environmental stressors, some events or situations that are traumatic, stressful. The diagnosis of OCD is based on the criteria from the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is a manual used by mental health professionals to diagnose and classify mental disorders. According to the DSM-5, you have OCD if you meet the following criteria. 1. You have obsessions, compulsions, or both. Obsessions are unwanted and intrusive thoughts, images, or impulses that cause you anxiety or distress. 2. You try to ignore, suppress, or neutralize the obsessions or compulsions with some other thought or action. 3. The obsessions or compulsions take up a lot of your time or cause significant distress or impairment in your social. 4. The symptoms are not caused by a substance, a medication, or another medical condition. The symptoms are not better explained by another mental disorder. But don't worry, there is hope for people with OCD. OCD is treatable, and there are effective ways to manage your symptoms and improve your quality of life. Cognitive behavioral therapy, CBT. This is a type of psychotherapy that helps you identify and challenge your negative thoughts and beliefs that fuel your obsessions and compulsions. It also helps you develop coping skills and strategies to manage your anxiety and reduce your reliance on compulsions. Exposure and response prevention, ERP. This is a specific type of CBT that involves gradually exposing yourself to the situations or stimuli that trigger your obsessions, while preventing yourself from performing the compulsions that usually follow. Medication. This involves taking prescribed drugs that can help reduce the intensity and frequency of your obsessions and compulsions. The most commonly used medications for OCD are selective serotonin reuptake inhibitors, SSRIs, which are a type of antidepressant that increase the level of serotonin in your brain. Brain stimulation. This involves applying electrical or magnetic pulses to specific areas of your brain that are involved in OCD. These treatments can be used alone or in combination, depending on your individual needs and preferences. The choice of treatment should be made in collaboration with your mental health professional, who can help you weigh the benefits and risks of each option. Thank you so much for watching Knowledge Zone. If you like this video, please give it a thumbs up and share it with your friends. And don't forget to subscribe to my channel and hit the bell icon to get notified when I upload new videos. I'll see you next time with more trivia and fun facts. Until then, keep learning and have a great day.